We're here with Dina. She has had a pretty extensive mid-grade chemical peel in the past. She had the Plush Purple peel, and that was probably, what, about 6-8 months ago, Dina?
Yes.
Well, today you're going to be getting a salicylic peel from Katie here, and you're also going to get a microdermabrasion beforehand. Getting the microdermabrasion done before will minimize the amount of flaking and peeling you have after the chemical peel, so there really will be no downtime with it. Other than having to put on a nice skin protector afterwards, you'll really be able to just go back to whatever you were doing before.
Good.
Usually around day 3 or 4 you'll have some flaking, but because of the microdermabrasion we're doing before the peel, it shouldn't nearly be so drastic as to make you not ever want to do this again.
Good.
Certainly it's not going to be the strength of the peel you had with the TCA Plush Purple peel. That's a full level peel that sloughs off all of the skin. This is more of just a maintenance peel for you. Although it would be a fairly strong peel for most people, for you this is going to be a very minimal peel.
Okay.
Sound good?
Sounds great.
Any questions beforehand?
Not really.
All right. Katie, she's in your hands.
All right.
Have you had a microderm before?
I have.
It's usually best to get them a couple of times a year. Even if you're an exfoliating kind of person. Even if you use an exfoliator at home a couple of times a week, it's still best, especially once you hit your 40s, to start getting either chemical peels, microdermabrasion, or the combination of both, just to maintain your results. What are you worried about skincare wise?
Pore size is one thing. I want to reduce the appearance of pores, and I still have some hyperpigmentation from all my years of sunbathing.
Well, your hyperpigmentation is much improved after that TCA peel you had, but certainly this is a good maintenance peel for you, and I think you'll be fine with it.
Okay.
You got some eye shields for her?
I'm just going to put these on your eyes to protect them.
There's a little bit of adhesive there, but really we'd rather protect your eyes and make sure that nothing can get to them. We don't want any of the acid to get on your immediate lids or into your eyes, obviously. So you're going to feel a little bit of sensory deprivation here, so let us know if you need anything.
Okay.
I'm going to start the microderm now, Dina.
Okay.
She's testing it on her arm to make sure that the pressure and the suction isn't too much.
I'm just going to start down at your jawline.
Okay.
How's that feel?
That's fine.
So microdermabrasion is basically a sandblasting of the skin with crystals, and the simultaneous suctioning of those crystals and the dead skin debris off into the machine. So there's no mess, and at the end of this your skin is very, very soft and much more uniform in texture than it will be beforehand. You know, pores, you said you were worried about pore size. Well, pores are essentially cone shaped, and the thicker the epidermis is, the longer of a period they have to go to escape and make their little hole. So the thicker your epidermis is, the taller the pores will be, and therefore the larger the opening will be at the surface. So if you can get rid of some of that epidermis, shave it away, get some of that compacted area off of there, your pores will appear smaller just because the openings aren't as wide, because they're not having to travel through as much space to get to the surface.
Now, is microderm the only thing that helps with pore size?
No, certainly anything that takes off epidermis will help with pore size. So the chemical peeling that you're doing, the chemical peel that you're getting today, as well as the one you've had done in the past, those will all help your pore size.
And Obagi.
And Obagi as well, because there's a glycolic cleanser in all the Obagi skincare lines. So the glycolic cleanser also is like a mild form of a chemical peel every day. One of the mildest chemical peels we do here at the spa is a glycolic peel. It's essentially a higher concentration of glycolic acid that's in the Obagi skincare lines, but it does the same thing. It cleaves off that outer epidermis and makes it more likely for us to regenerate skin underneath. Because it's clearing off that epidermis, every single product you're using will penetrate better. The skin is the largest organ in the body. They teach you that in esthetician school, right? Just to point out how important it is. It's our barrier to the world. It protects us, but it's also the thing that everybody sees. So you want to keep it in the best possible condition you can.
How are you feeling, Dina?
It feels good.
It kind of feels like maybe a cat's tongue.
A lot of people
Licking
say
your
that.
face.
It's a little bit like that. It feels a little bit like sandpaper, but certainly not abrasive in the way that sandpaper would be.
And not painful at all.
No, they wanted to find a way to be able to blast off epidermis without damaging the skin itself. And without hurting, of course, that's important too. And I think it feels very relaxing. The hardest areas to exfoliate yourself at home are those areas right around the nose and right around the corners of the mouth that tend to build up epidermis, and it's just a little bit harder to get all of that off yourself. Those of us with rosacea tend to build up epidermis on our nose. I know that's where I have most of my flaking. Getting a microderm really helps with that. Certainly it's nice to get a microderm before you start a new regimen, just to minimize the amount of flaking you'll have. When you start all of these Obagi regimens, you'll go through an adjustment period of a couple of months where you have a lot of flaking. You're producing more skin, therefore the old stuff has to come off. So if you do a microderm before starting those regimens or before starting retin-a, you will have a cleaner, fresher surface to start with and have less dead skin to lose in the process of starting all these regimens. What do you use for your skincare line?
I'm using Obagi Nuderm.
How do you like it?
Oh, it's awesome. You peel for a little bit the first few weeks, but after that it's great.
Have you added in any of the additional products? Do you use retin-a or a C serum?
I do use retin-a, but I'm interested in using the C serum, but I'm just not sure how you would go about doing that with all the steps that we have in Nuderm. I don't know how to add the C serum in.
If you've been using Nuderm and retin-a for a while, adding in a C serum, it's probably a good time. You're used to the Nuderm system, you're used to the retin-a, your skin has had a chance to adjust to all of those, so adding in a C serum now would be completely appropriate. C is an antioxidant. In much the way that an apple turns brown after being cut, that is from oxidation. The same sort of thing happens to your skin. So it's an antioxidant and it definitely protects you from oxidative damage. It's one of the main sources of aging. But it's also an acid, so it's going to be a little bit irritating, but it's also something that cross-links your collagen. So you're going to have better, firmer, more resilient, long-lasting collagen formation from the enhanced cross-linking from vitamin C. How long have you been on retin-a?
I've been using it since April of last year.
And what strength are you on, do you know?
I'm doing the 0.05.
The 0.05. It's probably time for you to move up to the next strength. So when you finish your current tube of the 0.05, I would recommend moving up to the 0.1% strength.
Okay.
It's about the strongest we use for the face, and you should always be on the strongest strength of retin-a that your skin will tolerate.
Okay.
I can tell the difference in you since you started using retin-a. Your skin definitely looks younger and more elastic, and I would wager to guess that you've probably doubled your collagen production over the period of time that I've known you.
That's good.
That's always a good thing. All right, well, it looks like the microderm's done.
It just leaves a little bit of crystals behind, so I'm going to brush those off for you.
Okay.
Cleanse you a little bit, and then you'll get your peel.
Okay.
How many layers of the TCA Plush Purple Peel did you get?
2.
All right, and you had significant peeling from that.
Mm-hmm. A lot.
Did your friends and neighbors, were they fearful for you?
Yeah, they thought my face was falling off.
That's the thing with the TCA pills. There's definitely downtime after them. You definitely have about a week period where you don't want to go out in public.
Mm-hmm.
These milder pills don't have that problem. You can wander around town without scaring the children.
That'll be good.
Alright, I'm going to start on your forehead.
Okay.
You may start feeling a little bit of a tingling, itching, sometimes a little bit of a heat feeling.
Mm-hmm.
But Rachel has a fan ready as soon as you want it. Just let me know as soon as you feel this.
She starts with your forehead because that's generally the most resilient part of your face. It tends to have the thickest, most resilient skin. And so that gets the initial application. And then we kind of move to areas that are progressively less hardy. So she'll move down to your cheeks and your chin. She'll finish.
Cheeks are definitely burning.
She'll finish off around the corners of your nose and your mouth.
So
you're feeling the heat.
Mm-hmm. Good.
So on a scale of 1 to 10, 10 being the most excruciating pain ever and 0 being none, what would you say your pain level is?
Between a 5 and a 6. I mean,
So
it's
you've got
burning.
warmth. That's good. This is
You're already frosting. That's
You are
good.
starting to frost up.
it's nice. What we call frosting is the crystallization of the acid that's being used. Not all acids crystallize, but the one you're receiving is. This is salicylic acid. It does form crystals. It's a beta hydroxy acid, so unlike the glycolic and lactic acids, it doesn't have to be neutralized. And so basically, once it's put on your skin, it's done. And there's nothing to reverse it. So how's your heat level?
Oh, it's a good 6 to 7.
So Kevin, I'll spray you a little bit with a toner.
Okay.
Soothe that. Just kind of right in front of the fan.
Does that feel better?
Oh, yeah, it feels a lot better.
That should start to calm down a
Oh, there
lot in a
it is.
couple of minutes.
It's just a rose hip and calamine type spray.
It smells good.
It's anti-inflammatory, it cools the skin, and yet it's okay if you open your mouth and drink a little of it. Sorry, I hope I didn't get any
Your
around.
fan helping you?
Yes, it is.
Okay.
You're
Yeah,
cooling?
it's completely
On a
it's
scale
not
of 1 to
burning.
10, how hot are you?
Oh, 1.
I'm
1.
going to put a cold rag on you just to calm that skin down. Sometimes you are a little red. That doesn't last for very long, though. Can you breathe under there?
I can.
Okay. Does that help?
Mm-hmm.
Excellent. Well, let us know if you have any questions over the next week or two, and happy peeling.
Okay, thank you very much.
We want to thank you, Dina, for allowing us to get up close and personal on your face, and thank you, Dr. Bell, for educating us on microdermabrasion and chemical peels.
Well, you're welcome. I mean, skincare is really important, and we all know a little bit, but the more we can learn, the better our skin will look. It's really brave of Dina to let us see her get a microderm and a chemical peel, and we do appreciate that. We want to remind everyone to check out our webpage, plushmedspa.com, and you can always get more information on beauty at our beauty blog, plushmedspa.blogspot.com. Please join us next week. We'll be back again. We'll have something interesting to show you and more to teach you. Bye.
This has been Plush Tonight with Dr. Amanda Bell. Thanks for watching.
I'm Dr. Amanda Bell with Plush Medical Spa. Did you know that Plush offers all the services of a big city spa right here at home? Our highly trained professionals offer a variety of waxing services and massages, including couples massage, deep tissue, and prenatal massages. Or treat yourself to a chemical peel, a facial, or a manicure or pedicure. Find us at 548 Westgate Parkway in Dothan or on the web at plushmedspa.com.